Welcome to TCM Board Formula Series. Today we review Xiao Qing Long Tang, Minor Blue-Green Dragon Decoction. It belongs to the category Release the Exterior and Warm Thin Fluid Retention. The fastest memory hook is this: wind cold outside plus thin, watery fluids inside, release the exterior and warm the lungs together. By the end, you should recognize the core ingredients, formula hierarchy, pattern picture, major differentials, and modern safety checks. This lesson is for board preparation and professional education. It is not a diagnosis, prescription, or substitute for individualized medical care. Build the formula from its ingredients. Ma Huang releases the exterior and disseminates lung qi. Gui Ji assists sweating and warms yang. Ganzhong warms the lungs and transforms thin fluids. Xin warms the lungs and disperses cold. Zhi Ban Xia transforms thin fluids and stops nausea. Wu Wei Zi restrains lung qi and prevents excessive dispersal. Bai Xiao preserves yin and moderates the dispersing herbs. Zhi Gan Cao harmonizes and protects the middle. On an exam, do not memorize the list as isolated names. Link each ingredient to the treatment strategy. The composition should explain why the formula fits its pattern and why a similar formula does not. Now organize the hierarchy. The chief is Ma Huang and Gui Ji. The deputy level is Ganzhong and Xin. The assistants are Zhi Banxia and Wu Wei Zi and Bai Xiao. The envoy role is Zhi Gan Cao. Together, the formula releases the exterior, warms the lungs and transforms thin fluids, stops cough and wheezing. A useful board habit is to ask what the chief attacks or Tony fees, what the deputies reinforce, and how the assistants control side effects or protect the middle. The target pattern is exterior wind cold with internal retention of thin, watery fluids obstructing the lungs. Look for this clinical picture: chills, fever, body aches, and little or no sweating. Cough or wheezing with copious thin white sputum. Chest fullness or difficulty lying flat. Nausea, heaviness, or generalized edema in a thin fluid pattern. The tongue is moist with a white coat. The pulse is floating and tight. The board answer comes from the whole pattern, not one symptom. Match the disease mechanism, the treatment strategy, and the tongue and pulse before selecting the formula. Differentiate carefully. Ma Huang Tang a Euro exterior wind cold excess without the strong internal thin fluid picture. Ling Gui Zhu Gan Tang a Euro internal thin fluid retention without an exterior wind cold pattern. Shigan Ma Huang Tang a Euro chronic cold phlegm wheezing with less emphasis on an acute exterior pattern. When two formulas seem close, identify the single feature that changes the treatment strategy. Ask whether the presentation is excess or deficiency, hot or cold, exterior or interior, and whether phlegm, dampness, food, blood, or sinking qi is the main driver. Safety is part of formula knowledge. Classical cautions include: ephedra alkaloids carry serious cardiovascular and neurologic risk. US ephedra dietary supplements are banned. Use only properly processed Banxia and verified Xin species and dose. Quality failures can be dangerous. Avoid in pregnancy, breastfeeding, children, uncontrolled hypertension, arrhythmia, cardiovascular disease, seizure risk, or hyperthyroidism. Severe breathing difficulty requires urgent care. Modern medication review includes: do not combine casually with stimulants, high caffeine intake, decongestants, monoamine oxidase inhibitors, or other sympathomimetics. Zhi Gan Cao adds blood pressure and potassium considerations, while Wu Wei Zi may alter drug metabolism and transport. Use a verified product, Document the complete medication and supplement list, set monitoring parameters, and refer when red flags exceed the scope of routine herbal care. Formula names do not guarantee identical composition or concentration across products. Finish with 5 board pearls. Number 1, 8 ingredients. Number 2, exterior cold and thin fluids. Number 3, copious watery sputum. Number 4, floating tight pulse. Number 5, Ma Huang safety restrictions. The one-line recall is, wind cold outside plus thin, watery fluids inside, release the exterior and warm the lungs together. Review the ingredient architecture, then practice distinguishing the nearest look-alike formula. This concludes Xiao Qing Long Tang. Save this lesson for spaced repetition, and always connect board memorization with safe clinical judgment.